A good understanding of the internal surface anatomy of the lateral wall of the nose is fundamental for both endoscopic and external DCR surgery. This understanding will enable the creation of an adequately sized and appropriately positioned bony ostium, and then complete marsupialization of the lacrimal sac, and will also help avert damage to neighboring structures such as the orbit, skull base, and sinuses. The inferior and middle turbinates are seen with the endoscope. The middle turbinate inserts onto the thick bone of the frontal process of the maxilla and the frontal bone. The anterior-most line of this insertion is called the axilla. The axilla is a constant landmark and therefore used to orientate DCR surgery. The maxillary line is the medial-most projection of the frontal process of the maxilla. It runs from the axilla of the middle turbinate to the root of the inferior turbinate. It is another very important and relatively constant landmark. The middle turbinate can be lifted a little to expose the middle meatus, which contains the uncinate process, the bulla ethmoidalis, the frontal recess, and the maxillary sinus ostium. The vertical portion of the uncinate is a flap-like structure that guards the ethmoid sinuses and their sinus drainage, as well as the maxillary sinus drainage. It attaches to the frontal process of the maxilla. Endo-DCR surgery is almost invariably conducted with an anterior approach, which does not require formal uncinectomy. However, the root of the uncinate is frequently detached to allow exposure of the superior lacrimal sac. Just behind the uncinate, the bulla ethmoidalis can often be seen projecting further medial than the uncinate. The fundus of the lacrimal sac typically extends around 6 to 10 millimeters superior to the axilla of the middle turbinate, and the nasal flap and the bony ostium beneath should therefore be sized accordingly. The sac size, and therefore inferior extent, is very variable, but generally a nasal flap and rhinostomy extending to around halfway down the middle turbinate is adequate to expose the full sac. Similarly, the anteroposterior position of the sac is variable, but once the sac has been partially exposed, the bony ostium location can be suitably positioned and sized.